Oh, oh, so sorry. Yeah. Thank you.
Okay. Michelle, come on up and get mic'd and I'll. Thank you, Katie. That was fantastic. And we do all of those testing that she described in our practice here. But it is very confusing, and it's really helpful to have it broken down so clearly. So, as we've developed our cancer care program here in Alaska, we've increased our awareness and our integration of supportive oncology in lots of different ways to our program. And one of those ways has been through the incredible work of Deb Boots, who's texting right now. Hello, Deb. And she, like, a round of applause for Deb, because she really has spearheaded our oncology massage program. We now provide massage during chemotherapy to our patients who are getting infusions. And she's gone out of state for training and worked with Teresa very extensively as well. And the latest is actually bringing up Michelle to train massage therapists from around the state in lymphedema massage and oncology massage. And we timed this most recent training immediately before this conference so that we all could hear from you and learn more about the benefits and the process of lymphedema management and oncology massage. So thank you so much for coming and welcome. And I can't wait to see what you're going to share with us.
All right. Well, thank you for having me. I've been looking forward to this. So, all right.
And then just make sure you're projecting that mic for us.
All right. Can everybody hear what I'm saying here? Okay, great. So thanks so much for having me up here. I'll scoot this up. There, is that better?
That's better.
Okay, all right. So thanks so much for having me up here in Alaska. I am from Sacramento, and before Sacramento, I came from Denmark. So if I have an accent, that's where that's from. I'm here today to talk a little bit about massage therapy and how that plays a role in oncology massage. I'll dive into what kinds of trainings we have and the different kind of progressions that massage therapists might do to advance their training so that you are better informed when you're seeking out massage therapy. We'll look at what oncology massage actually is, what lymphedema management might look like in private practice, because it's different from when you go into a hospital setting and see a PT. And then I'm going to touch really quickly on plastic surgery recovery or post-op care, just because that's kind of an expanding field and it's important to touch on as well. So that's me, and this is the things that I've done in my career. In addition to having a private practice, I work for a nonprofit, which is Greet Today. That's the training program that was up here very recently in just last weekend, same conference room. And we now have 11 new massage therapists trained in the area, all the way from Eagle River, Girdwood, Wasilla. One came down from Fairbanks. So there's options out there now, which is amazing. So let me just start with telling you why I got into oncology massage and why this means so much to me. And it's all because of this guy. That's my dad. And my dad passed away in 2007 from esophageal cancer. He got diagnosed in May and passed away in September, so pretty short. We took care of him at home, me and my mom, because he didn't want to go into a hospital or hospice care. And my mom's a nurse's aide, so we kind of helped out that way. So I've seen all the good, the bad, and the ugly that comes with, passing away from cancer. And what stood out to me the most was I was surprised that there wasn't something more to do. I wanted there to be something else to alleviate some of the anxiety or some of the stress and some of the pain that comes with passing away from cancer. And that's where oncology massage comes in, because oncology massage actually helps with reducing stress and helps with reducing anxiety. In some cases, we see benefits with neuropathy, lowering blood pressure. So in the infusion center I work in, for example, some of the nurses will call me over when we have a very anxious first-time patient coming in, and we'll do the massage before they get hooked up to the IV because it lowers the blood pressure. And we know that sometimes if the blood pressure is too high, we can't actually administer medication. So that's really beneficial. It can help with pain and just the sense of loneliness, which really became a big deal during COVID. So that's where massage therapy plays a huge role in what we do. So that's all because of that I got into that, and he gets to go to work with me every day, which is kind of amazing. So massage therapists, what are the different types of training? I would say the basic training is the one that I just taught last weekend, which used to be a 24-hour program. Now it's 32. And once they've taken that class, they can become preferred practitioners with Society for Oncology Massage that has a national database where you can put in your zip code, and everybody who is registered there will pop up, and you will know that they have received similar to Greet the Day or Greet the Day training quality, which is amazing. We also have what we call an intro program, which is 16 hours, and that allows you to work with people in long-term survivorships only, because oncology massage is not only important while you're in treatment, it's important for the rest of your life, because of some of the treatments that you receive during cancer put you at risk for something like lymphedema for the rest of your life. So you need the same or similar modifications. Then the next up here is CMLDT, which is Certified Manual Lymphatic Drainage Therapist. They take 45 hours of training, and they are trained to work with mild to moderate, well-managed lymphedema. And they also work on things like mold or systemic autoimmune diseases and things like that. I am also a certified lymphedema therapist, which is the more extensive training. And we learn how to do bandaging, garment measurements, exercise programs, skincare, and a lot of patient education. And I'm pointing that one out specifically because I feel like that's where massage therapists really shine, is with the patient education, because we have much longer time with our clients when they come into our offices that they're sometimes allocated in a PT setting. And then lastly is the post-op care. So it's a new field, and right now there isn't like a comprehensive training out there. ACOLS, which is another organization, has a 45-hour program, and it's okay. I will say that with the combination of oncology massage and certified lymphedema therapist, you are much better off. So when you're looking for therapists out there, you want to ask some questions. You want to ask, do you have oncology training? You don't need to remember how long the training was for, but like at least know that they need to have the basics down. If you are looking for manual lymphatic drainage therapy, you know, at least the 45-hour, and they will have the CMLDT or CLT after their titles as well. So that's super important. Oncology massage is really learning how to modify for certain types of treatments that people are going through. For example, if you have radiation and you're experiencing radiation burns, then of course we cannot touch that area, but you have a whole rest of the body that we can work on. If you are experiencing any kind of nausea or fatigue, or your blood counts are low, then vigorous or deep massage therapy can actually make that worse. So we have to modify our pressure. I will say the most important part that we learn as oncology massage therapists is the direction in which we're applying our strokes. Because if you've had any lymph nodes removed or biopsied, radiation or surgery in what we call a primary routing cluster, where there's like multiple lymph nodes sitting, which is the neck, your armpit, or the groin area, then you are at risk for lymphedema for the rest of your life. And there isn't enough research out there right now that kind of tells you what is the percentage of risk, unfortunately. But why not just go and see somebody who's trained, and then you don't have to be at risk at all. So we also have like 3 categories, which is long-term survivors, recent recovery, and in treatment. And we categorize it that way because as you're going through the different stages, you might be eligible for deeper pressure later on, or maybe we can ease up on some of the modifications that we're doing. So it's important for massage therapists to know where you are in your treatment. And I know that recent recovery is kind of like a moving target, right? It depends on how well you're doing and recovering. But I promise you that each massage therapist, if they've taken the training, they will know based on the questions they ask and the answers you give where you're at. These are just some of the things that we modify for. It's not an extensive list, but these are some of the things that massage therapists learn about during their training. I've highlighted the lymphedema or risk of lymphedema because it really is super important. A lymph node biopsy is a diagnostic tool, and sometimes it's kind of forgotten about a little bit as a patient because it's like, oh, I just had 1 lymph node removed or 2 lymph nodes removed. Or even some patients have reported to me, it's just biopsied, which we think of as a biopsy as taking a small part of something out. But a lymph node is so small that once it's gone, and they don't grow back. So that's why that one is so important. Again, oncology massage is really just about learning how to modify your techniques. So if your favorite massage modality is good old Swedish relaxing massage, or if you're looking for scar work, or if you are looking for more of a therapeutic modality, then it's not that they are doing oncology massage, it's that they're modifying their techniques to work for oncology clients. So you can still receive your favorite massage. Quick about complete decongestive therapy is a type of treatment that lymphedema patients go through once they're diagnosed. And as of right now, how it usually works in America is you get a diagnosis and you go into PT for what we call phase 1, which is the reduction phase. We try to reduce the limb size as much as possible, and also work on tissues, which can become firm if it has gone for a while. So we call that fibrotic tissues. You can soften those up again. Right now, I believe that most patients receive like 2 to 3 sessions per week. At the Fully Clinic in Germany, where this technique was invented, they do 7 days a week. So it's a little bit different. And the treatment is you come in, you get your bandages unwrapped, you get a manual lymphatic drainage session, you get lotion, you get bandages back on, and then you do physical therapy. That's 1 session. So phase 2 of that is once you're released and you have reached the goals set out in the beginning of your PT sessions, then you're released out into the world and you have to manage your lymphedema because there's no cure for it right now. It's all about managing it. And that's up to the client or patient themselves. I switch between client and patient because we say client in massage therapy and patient in the hospital. And so, but that's up to the patient themselves to kind of figure out how to manage that. We manage it with manual lymphatic drainage, with wearing your compression garments, with exercising. Some are starting to look into different kind of dietary programs. We have lymphatic pumps, vibration boards, KT taping. There's a lot of tools out there, and every year something new comes up. For example, just very recently down in my area, UC Davis now has a microsurgical team that does lymph vessel anastomosis surgeries and lymph node transplants, which is something where you connect the lymph vessels into the venous system and it helps the lymphatic system. And lymph node transplants is taking lymph nodes from one area and putting them into an area that needs more help. So there are continuously new things happening. And it's a lot to navigate on your own. It's a lot to navigate on your own. And that's where massage therapists come into play, because a lot of people come and see me once a month for manual lymphatic drainage, and we can talk on the table. We have an hour to chat about the newest things, or how do you like your new pump, or let me have a look at your garment. Oh, this one's pretty old, isn't it? It's 6 months old. You should really be switching these out every 6 months. So that's where the massage therapy comes in. It's like a support system, because getting in with a PT, I don't know about up here, but in Sacramento, we sometimes have to wait 6 months to get in to see a PT for lymphedema treatment. And that's a long time. That's a long time to not get managed, where the limb just grows and where the inflammatory reaction in the lymphatic system gets worse. So manual lymphatic drainage is the core component. And I am trained in the Vutter technique. And it's a kind of a fun throwback because Dr. Emil Vutter was Danish. So it's a little fun fact there. The other big school is the Chickley school. Those two techniques are the most recognized and approved, and specifically for lymphedema management, because you need a little bit more. It's not aggressive technique, but it's a little bit of a deeper sort of technique than some of the 2-day programs out there teaches you. If you see a massage therapist and they've taken a weekend class in manual lymphatic drainage, don't let them work on your lymphedema. They're not trained in that. They're trained in like wellness manual lymphatic drainage. It's the, Beverly Hills ladies going in for manual lymphatic drainage before the red carpet, and they lose a couple pounds and look great in their dress. That's the kind of training they have. Not working with compromised lymphatic system and reroutings and things like that. So the 3 things that moves lymphatic fluid is diaphragmatic breathing, muscle movement, which is why exercise is important, and manual lymphatic drainage. So that's really important. I will say, if you're looking for something like an exercise, the best exercise to do is anything aquatic, so in the water. Because when you go in the water, it's like you're wearing a compression garment for your whole body, which helps move the fluid more efficiently. So CDT in private practice is a little bit difficult because as a massage therapist, I cannot bill insurance, so it's out of pocket. The other thing is that bandages. So if you were to come to me for like the phase 1 part, bandages are really expensive and people would have to pay out of pocket for that. However, where it becomes interesting and where massage therapy kind of has a spot on its own is when insurance fails or when it runs out. So sometimes people will get 12 weeks of like approved care for lymphedema, and then they're released into the world. And that person might say, I don't really feel like I reached my goal. Like, I would like to continue with this. So seeing a certified lymphedema therapist and paying for another couple of sessions with them might be beneficial. The other thing is, if your insurance doesn't cover, and then going in and having to pay out of pocket for a PT is sometimes more expensive than paying out of pocket for a massage therapist. So there is an option there. And then really where we come into play is the maintenance phase. So just remember that we still have to work within our scope of practice. We do not do wound care. However, if your garment has made an indentation that has now become a wound, we would be able to look at it and say, you need to go back to PT. This one specifically, you can get, a new referral for, and go in and see PT and wound care. Cellulitis is very prevalent in lymphedema patients because protein loves bacteria and bacteria loves protein, and we all have bacteria living on our body, and lymphatic fluid is high in protein. So if you get a wound, those two kind of make a reaction, and that can become cellulitis. So, okay. Another place where massage therapy doesn't really work well is what I would call late-stage lymphatic disorders or lymphedema. So what we call stage 3 or stage 4. That's when you're seeing the big lobules and things like that, just because it's a lot easier to treat with more techniques and tools available, which they would have in the PT office, essentially. Okay. So management really is where the massage therapists shine. And I'm a CMT because in California we're certified, but up here, your therapists will be LMTs, which are licensed. So lymphedema, how does it look? How do we find out? So there has to be two things happening. So there has to be an underlying cause, and then there has to be some symptoms that kind of shows you that you are now at risk for lymphedema. So if you've had radiation, lymph node biopsy, or surgery in a primary routing cluster, and now you're experiencing things like swelling, heaviness, tingling sensation, that's like the earliest signs of lymphedema. Once you start swelling, and it's a much more easy for you to see, we have techniques where you can do like a whole body scan, and they can see if there's one leg or another leg that's bigger. With gynecological cancers, what I often see is a truncal edema. So it's not just the leg, but you also can get swelling in your abdomen and low back, which can be harder to treat because the compression garments work really well on limbs and less efficient on the trunk. So again, has to be an underlying cause and then a triggering event. We don't know what triggers lymphedema exactly, because somebody can have one lymph node removed and then 6 months out of treatment, they get a mosquito bite and that triggers an inflammatory reaction that becomes lymphedema. And some people have surgery, full lymph node dissection, radiation, and they fly every weekend and they go hiking at Mount Denali and they never get lymphedema. So there needs to be more studies done on these things, but we know there has to be an underlying cause and a triggering event. And it's important because there are risk reduction practices that you can do to kind of help you not prevent, but minimize your risk of developing lymphedema. National Lymphedema Network, or LEARN, has come out with like a 32-page PDF document. And Michelle Sanderson and I decided to make that document into a 30-minute video because that seemed a little bit more digestible. So if you want to take a screenshot of this or access the PowerPoint slides later on, it's on YouTube for free if you want to watch it. Okay, plastic surgery recovery, real quick. So some of the things that we see with gynecological cancers is like scars from any kind of hysterectomies in and around the abdomen, or surgeries that takes out other kinds of organs, or like we saw this case earlier today with really big tumors or cysts that is then operated out or leaves some sort of scar. And where that becomes important is because if that scar interferes with the lymphatic system, which it will, because once you cut through the skin, you're cutting through the lymphatic system, it can have an effect on you. And you maybe have lymph nodes removed, and then your second surgery is a triggering event. So that's where it becomes important. Plastic surgery recovery done correctly is manual lymphatic drainage after surgery, move some of this inflammatory, fluid out of the region, putting less pressure on the lymphatic system. It also helps with scar healing, which can be important for range of motion and for the look of the scar. And that's really important too. So that's what comes into play. And then, of course, if there's any kind of secondary cancers, we see it a lot with breast surgeries, and what's the newest one is like liposuction to create breasts, essentially, kind of like the BBL for breasts. So we're seeing some of that. And then with the liposuction, it becomes important because that's a really, really harsh thing to do to your body. So even if you didn't have, huge surgery, maybe you're considering an elective surgery later on, you might want to consider what and where that surgery is done based on what your lymphatic system has already gone through. And then there's a content graphic warning real quick, because these are some of the things you do not want to see your post-op care therapist do. It has come out of South America, predominantly in Miami, to do incisional drainage, which is pushing fluid out of the body. And that's not good. Like if you have fluid coming out of your body, you would have a drain put in by the doctor, and that's all done by them. The other thing is that even though we clean really well in our massage practices, that is not a sterile environment. And I've heard horror stories like massage therapists pulling Q-tips out of their pocket and reopening wounds and pushing fluid out of people. So you see some of this, you run. The other thing is wood therapy. Wood therapy is really harsh on the lymphatic system, and on an intact, non-compromised lymphatic system, it's fine. But on someone who's had lymph nodes removed or radiation where the lymph system is impacted, this is not a good idea. The other one is ultrasound or frequency techniques for moving lymphatic fluid. It's not researched enough to be something that you want a massage therapist to do. So just a couple warnings there. Recap real quick. So when to call who? So if you're in treatment, you want to call a massage therapist who has at least the core training, right? The 24, 32 hours. Those can be found on Society for Oncology Massage websites, or contact Debbie and get the list of newly grads from the last class. If you are a long-term survivor, it's okay if your massage therapist has taken the intro program, because they're taught to work with the lymphatic system in a massage kind of aspect. Now, if you are in lymphedema management, you want to look for a CMLDT or a CLT. And then if you're looking for post-op care, just be aware that right now, there is no title, there's no certification for plastic surgery recovery. Even the ACOLS class, even though it's a certificate of completion, it's not a certification, which is two very different things. So you want to ask a lot of questions. What are they trained in? And at minimum, if you're a cancer survivor or a cancer patient, you want them to be oncology trained and have some sort of manual lymphatic drainage training that isn't a weekend class. So locally, how do you use this? How do you find that? Well, Society for Oncology Massage is really good, but I've kind of heard rumors that not many massage therapists use that up here. So I would say Luke, and then find Debbie for massage therapists. And you also want to look for estheticians who are oncology trained. We had one esthetician in our class, so that's important too. CLT is a little bit difficult too, because unless you are nationally certified, which is called LANA certified, you don't get on any kind of database. But all of us are very proud of what we do, so we'll have that title behind our name. And then a couple of resources, but then I made this slide and then I came to Alaska and I realized that you guys have the most amazing community up here. I don't have to teach you about any of your nonprofit organizations like Luke or anything like that, because you just back up each other. I was so impressed. Every turn I go, people just show up for each other, and that is just so heartwarming. So thank you so much to Luke for having me up. And then I know if you have questions, we're going to have a session. But if you didn't get your questions answered, then come find me in the hallway.
Okay, that was one.